more on this, I'm joined by Joseph Williams, who writes on health and access to care at US News and World Report. Hi there again, welcome to the program.
Hi, thanks. Great to be here.
Always good to have you. So the US federal government and many companies are now requiring that employees be vaccinated before returning to work. And it's creating quite a brouhaha, sparking debates even. Yet to many international viewers, it almost seems like a no-brainer. Is this what's become a first world problem?
Well, it's become kind of an American problem. I mean, everybody, at least most of the people in the Western countries, believe that that vaccines are effective and that masks do help prevent infection. I mean, we've seen that. There's a track record indicating that that's so. But the problem in the United States here is that everything has become politicized, even public health. So while we have effective, easy to get free vaccines here in the United States, anybody who wants one can get one. We have a fair number of people who refuse to get it simply because the government insists that they do. And anyone who believes that is also more likely to have voted for President Trump. And even as you see infections tick up to around 500 or so a day, or deaths rather, around 500 or so a day, it seems incomprehensible that somebody would not want to protect themselves against this vaccine, but it has become politicized. It is a polarized country here, and we're trying to figure out how to get everybody on the same page without having to go through all of this sort of thing.
It's such a good point, this politicization of public health, because we're seeing all these stats. I mean, the vaccination effort is flagging, and there's this direct correlation, right, of states with high cases and deaths having low inoculation rates. So what can the government do? I mean, what's proven effective in the past in reaching those who are hesitant?
Well, the government has stopped short, the federal government at least, has stopped short of asking for a mask mandate, and that's because a lot of localities and many businesses are taking that up for them. You have Delta Airlines, Google, Facebook, even CNN had fired, they sacked 3 people who refused to get vaccinated, so they lost their jobs. You have many more companies stepping up to the plate, insisting that their employees get vaccinated, because it's not just an individual rights issue, it is a public health issue, and you may have the right not to get vaccinated, but does that give you the right to infect a coworker, especially now that the highly contagious Delta variant is part of the equation now? And variants will continue to evolve the more people refuse to get vaccinated or refuse to wear masks. So it becomes a self-fulfilling prophecy. The more people who refuse to wear masks, the more likely the virus is to replicate, and we don't know where those replications might go.
And we're also learning from the CDC this week, Joseph, that fully vaccinated people who get a breakthrough infection can transmit COVID-19 as well. Does that change our approach to this disease?
It changes how the disease is viewed. And I think that's one of the reasons why the mask mandate came back into play after all but disappearing over the spring and early parts of the summer. Because the Delta variant is so contagious, even people who have been fully vaccinated, they may be asymptomatic. They can transmit it to someone else, hence the guidelines on wearing masks. And if you do have the vaccine and you do contract the Delta variant, you may get a flu-like symptoms, you may get some mild discomfort, but you're not going to be required to go on a ventilator 9 times out of 10. And that is another reason why we're calling the recent upsurge a pandemic of the unvaccinated. 99.8% of the people who are on ventilators, who are in hospital ICU units, were not vaccinated. They contracted the COVID virus. We have anecdotal stories of doctors hearing patients on their sickbed begging for the virus, only now it's too late.
The stats really tell the story. Very quickly, we have about 30 seconds left, Joseph. This week we had the WHO issue a plea against people in richer nations to get a booster shot, only because so many others in the developing world are clamoring to even get 1 dose. Do you see this issue of vaccine equity getting solved anytime soon?
Not anytime soon, especially now that we've got such confusion and mixed messages on who should wear a mask, who should not. But the fact remains that unless the globe is safe, unless everybody is safe, variants can pop up and nobody is safe.
Joseph Williams, always a pleasure to speak with you. Thank you.
Thank you.